So today we're going to approach a typical lip that would maybe walk into your office. It's a pigmented lip. One of the issues with this lip is that she doesn't have a very defined border, and there's also a pigmentation issue. So for patients like this, I like to recommend getting some lip blush because that will correct the pigmentation, something that I cannot correct with filler. If you do not have a defined border, yes, I can help you out with filler. However, sometimes that doesn't last very long, right? It lasts maybe a month, 2 months, but the border will end up subsiding and you will go back to a flat lip. So for a patient like this, I like to recommend lip blushing. Now, if I'm going to do the filler, the first thing that I do, if you ever come to one of my courses or you've watched me do lips before, you know that I like to pre-mark the lip or map the lip out. So for somebody like this, which is a very difficult lip because you can't really see the border, I'm going to turn it this way. I'm going to start sketching, and usually this is a white pencil, not a black Sharpie, but I'm going to start sketching. So the first thing you want to do is find the middle. So let's find the middle. The next thing we're going to do is we're going to find the peaks of the cupid's bows. Third thing we're going to do is we're going to find the nasal ala. And then we're going to connect those things together, which just makes it so much easier to mark or to map. This is how I teach in the trainings. We're going to connect the dots here. And of course, usually when I am drawing with a white pencil, I take a little alcohol and I clean it up, but this is how you're going to find the marking. So you can see that now I've marked her lip. And also, if you have a hard time finding the peaks of the cupid's bows, you can have the patient pucker their lips up. And once they pucker their lips, usually the peaks will come out. So that is one way to do it.